It's Breast Cancer Awareness Month, and this morning we are hearing from multiple doctors. From the START Center for Cancer Care, Tiffany Huertas explains the importance of talking about breast cancer, the signs and symptoms, and what the surgery process looks like after diagnosis.
Breast cancer is one of the leading cancer diagnoses in the United States. The CDC says nearly 240,000 women are diagnosed with it every year.
When compared to a lot other cancers, breast cancer holds about 30% of cancers every year that are being diagnosed in the United States.
There are many signs and symptoms to look out for when it comes to breast cancer. Those include any new lumps, changes in texture to the skin on the breast, retraction of the nipple, and pain in the breast. Doctors say looking out for symptoms is important, but early screening will give the best results.
Only 1/3 of the patients with breast cancer, they're diagnosed by symptoms. Most breast cancers are caught by early screening.
There are modifiable and non-modifiable risk factors that can cause a woman to get breast cancer. Modifiable risk factors are things you can control or know about, like your alcohol intake, your weight, and genetics. Non-modifiable risk factors are things you can't change, like the age of your first period or when you start menopause.
So if you have an earlier onset of periods and late menopause, then you have a higher estrogen exposure, which means you're at a higher risk of breast cancer.
Doctors at the START Center for Cancer Care are putting an emphasis on women over the age of 40 getting a mammogram yearly. They also recommend doing a self-breast examination once a month.
If it's early stage, then the survival, the 5-year survival with treatment is, 95 to 99%, meaning, most of them, 95 to almost 100%, will be cured.
When a woman is diagnosed with breast cancer, she has many treatment options. Those include radiation, chemotherapy, and surgery. There are 2 types of surgery women can get when they have breast cancer. One is called a lumpectomy, which means only the part of the breast affected by cancer is removed. The other surgery is called a mastectomy, which is when the whole breast is removed.
Thankfully, with good reconstruction techniques and good plastic surgeons, that we can offer breast reconstruction to the vast majority of our patients who are required to undergo mastectomy.
Again, early detection is the best way to make sure you stay safe from breast cancer. You can read more about Breast Cancer Awareness Month on our website, ksat.com. Tiffany Huertas, KSAT 12 News.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.